might to keep this in between the time limit, so I'm trying my very, very, very best. Obesity and weight loss. Okay, women of color, and lower income Americans are unequally more obese. What? The rise of obesity is being treated with weight loss medication. When? Obesity has been on the rise since the 80s, yet effective weight loss medication has started to spread in 2020, which brings it to present day where it's still all talked about in the media, where we will focus on America. And it's notable that in a society with such an advanced and admirable healthcare system, it's very confusing and that we're in an obesity epidemic. So why? These unequal distributions are due to food deserts, which is the low access or no access to good quality food, often in low income areas or small towns or isolated towns. And affordable food is another huge factor. Even if you have access to healthy food, it has to be affordable. And knowing that low income Americans are at higher risk, this is a huge thing. Women are more affected because of this. And so as I was researching, I'm not going to go into it too much, I saw a lot of things saying that women are more affected by obesity, and I couldn't find anything besides like intersectionality points of like being a woman and being a single mother, or being a woman and being low income. But the actual biological factor of it all is that women and men distribute weight differently. As we see, men tend to carry weight more in their stomach or chest area, whereas women tend to carry more weight in their hips, butt, thighs, chest, stomach, arms, everywhere. Lovely being a woman. Okay, so the health outcomes of being obese, as we've seen, according to the CDC, obesity has been linked with a lot of negative health problems and diseases. So this could be changed for so many Americans through these weight loss medications. It can prevent or help long-term effects of obesity. But the problem is that this drug is so expensive, and insurance isn't the most reliable thing for coverage. According to the National Library of Medicine, depending on the weight loss medication you are on, it can cost upwards of $1,000 a month. And understanding that low-income families are a huge proportion of this is a huge problem. And this also causes Americans to rely on drugs, as they don't have things to help after the medication, bringing they're on medication, off medication, on medication, off medication. So this just kind of shows the cycle that this puts individuals in. Response. So to this epidemic, they release weight loss medications like Ozempic, Zepbound, Mounjaro, and the intended effects of these are to suppress appetite, inhibit the absorption of fat, that's a typo, slow the release of food to prolong the feeling of being full. These medications are extremely effective. According to a research put out by the National Library of Medicine, a group of 327 Americans were given semaglutide, and it showed 17.3% effectiveness. Yet at the end of this procedure or experiment, most of the patients gained weight back to baseline, proving that these medications are so effective, but only if things are put in place after the medication to keep off the weight. So media representation, and this can get very opinionated for me. I feel like this is glorified in the media compared to like things like burning off the weight by working out and changing your diet often aren't glamorized in the media and are seen as hard work. But even just this, a weekly shot to lose weight is just advertising the convenience and the positiveness of this medication, while things like this saying, yo ho ho, it's magic, or the Ozempic, it all just makes it fun and positive and kind of really overshadows the negative effects. And I also want to touch how celebrities have such an impact on society. And For example, Oprah has done a decently transparent job of explaining she's taken weight loss medication, she's gained weight after she gets off them, then she does this and that. She's been very transparent, and that's not typical in media, as weight loss is a marketing scheme in media. Okay, connection to public health. Obesity, according to the CDC, is linked with type 2 diabetes, cardiovascular diseases, and some cancers. And then, according to the National Library of Medicine, in 2021, in a study from 2021 to 2023, they reported that 40.3% of adults in America were obese. This number is shocking and crazy, and public health could greatly intervene in this by putting in preventative service that would solve the problem for younger generations. Here is our problem. These two pictures are, besides the palm trees in the back of this one, you couldn't even tell where this is. This is our society. We have fast food at every corner. We have multiple McDonald's on the same block. We have obese people as of 40%, accounting for 40% of our population. And things like this are very dangerous to me. These people have every right to be confident, every right to show off their bodies, every right that any other person has, they have. My only thing is, this is healthy. This is dangerous to me to promote that these things are healthy. It's just dangerous. You never know what could happen while promoting this. I feel like if we altered this to confidence, rather than health, it would be so much better. So the relevance. I cannot stress the amount of relevance this has in today and age. Americans rely on expensive health care for their health. And at the end, after they're done taking it, it has the reverse effect and they gain the weight back. Obesity can also lead to death. This is a huge problem, and we've seen obesity-related mortalities on the rise. This could save so many Americans' health and positively benefit their lives and overall health, including mental health. And in my opinion, the only way that can happen is if we pair this weight loss medication with lifestyle changes. So in my opinion, weight loss medications are great for people in health crises that need to lose weight and fast. I personally wonder if that effect would happen, or what effect would happen if we paired this with things like personal trainers, dietitians, nutritionists, and just overall health education, how this rate would change. Also adding realistic and reasonable, exercise into people's lives can greatly change this. I see the benefits of this drug, but I'm nervous about the media outlook and that effect on early generations and present generations. I worry that this medication is being used to temporarily fix a problem, and it doesn't set the patient up to become healthy and change their lifestyles, yet it makes them a lifelong patient to our medical care system. Here are my sources. I hope I'm in time. I'm so sorry if not. I've done this so many times.